Sorry for bothering you so late.
It's not bothering me. It's not late. What's on your mind?
I'm pregnant.
You're pregnant.
Yeah, I am. And it's yours.
Yeah, I guess it makes sense. Well, I warned you, those crunch berries could be an indulgence.
They most certainly were.
You're going to have the baby?
Yeah, definitely.
Okay.
But I need you to know, Dean, that I don't expect anything from you.
Well, what does that mean?
You know, if you're past this, I can do this alone. There would be no hard feelings, anything.
I'm not past wanting to be the father of my child. I just need to absolutely know that this is what you want to do.
Yeah, I do. I want to be a mother.
Okay. I didn't know that.
Neither did I. Until I saw that positive test, and then just all these feelings just hit me so hard. It's kind of shocking because, you know, I never felt like this was in the cards for me.
Why not?
I'm an addict, Dean. I didn't deserve a child, and it certainly didn't deserve me.
Stop it. That is a lie, and you know it.
I do now. But you were a big part of that.
Glad. But look, you know, whatever you need, I'm in. Okay?
Just two friends having a baby.
Yeah. Yeah.
Uber Eats finally dropped off your breakfast sushi.
Wow.
You should ding that 5.0 rating.
Yeah. Hey, all yours. 48. You were rocking that OBGYN green.
John?
You know, maybe if you told people why you can't eat raw fish, you wouldn't have to waste any.
Soon.
You're 3 months along. What exactly are you waiting for?
Can we not right now?
Just saying, your baby daddy might be getting a little impatient.
Incoming, triple trauma, house fire with bad burns, 2 minutes out. Trauma one's ready.
Ricky Aldridge, 11-year-old male. Burns to his right arm and leg. Looks deep in some places.
Where's my dad?
Right behind us, Ricky.
Breath sounds clear. Sats 96 on 2 liters. Heart rate 125.
What happened? Father made a quick trip to the grocery store. Ricky was sleeping. Came home to find the second floor engulfed in flames.
My dad carried me out. He saved me.
It's okay, buddy. We got you, all right?
43-year-old male with burns to his chest, abdomen, and all 4 limbs. Put him on a face mask. Gave him 8 of morphine en route. He was pretty agitated.
100 of fentanyl and pull some Versed in case it's not enough.
Copy.
All right, I'm gonna need you to be still, sir. Be still, please.
Please, this is fun.
On my count, 1, 2, 3. Find who?
His wife. He got his son out. By the time he went back in for her, the flames had consumed the primary bedroom.
Can't breathe.
Can't breathe.
Right, oxygen's down to
Back blade,
87. Heart rate 145.
Accommodate and sucks her in.
Move. All right, I'm in. I have to do a chest escherotomy.
I need some help if you can spare it, Dean. His wife just came in.
Yeah, go, go.
I'm guessing about 80%.
Oh, it's closer to 90% full thickness. Morphine drip.
Copy. Dr. Lennox, she's responsive.
Becky, I'm Dr. Lennox. Your burns are severe. I'm sorry, this is a non-survivable injury. Is there anyone you want us to call? We will do everything we can to make you comfortable, okay? You're not alone. I'm here.
Propofol?
I'll grab it from the med cart.
Peak pressures are improved. Time of death, 7:43.
Colder than Lake Michigan in February. But when you're done, you feel so good. Your veins pump that oxygenated blood.
Arteries.
What?
Your arteries pump out the oxygenated blood. Your veins bring it back.
Sure. Now, as a first timer, it can be pretty shocking to your system. So just do your best. See if you can challenge yourself to hit a minute. Honestly, even 30 seconds. You're psyched. Any questions?
No.
Great. 9:20. We'll see you then.
So everybody knows about the baby and that Archer's the dad?
It's all anyone is talking about.
Oh.
Congratulations, by the way. I'm so happy for you guys. You know, I was always Team Dasher. I mean, that tension between you guys.
Team what?
Oh, that's your ship name. Dean plus Asher is Dasher.
No, Doris, there is no team and there's definitely no ship.
So no wedding bells?
It was a one-time thing that just happened. You know, I would prefer if everyone, would focus on their work.
Right. Right, totally. And I respect your boundaries.
Thank you.
Yeah. But just to be honest, we're gonna be dining on this for a while. Thank you. Life is never gonna be the same. You're gonna be a mom, and Archer is gonna be a...
Papa! There he is. Who knew you had it in you? Bit of a May December thing, though, you old goat.
Yeah.
I gotta say, pretty wild, though. It's starting a parenting journey at this point in your life.
I get the feeling a lot of people think it's wild and ill-advised. Boy, I tell you, I didn't feel old until I saw the way everybody was looking at me today, like I was some sort of medical marvel.
Oh, come on, don't do that. You know that studies show that parents who have kids later in life actually live longer? So, you got some bonus years coming to you.
That does not help.
Okay, look, all kidding aside, I think that this is fantastic news. Really, I do. Who cares what other people think? I mean, in what world could this possibly be a...
Tough break. I heard about Hannah. You doing all right?
Sure, why wouldn't I be? What? I mean, obviously it was a shock, but I've moved past it.
Yeah. In 12 hours?
I'm with Sadie and I'm happy.
Okay. Yeah. Good for you. You got to admit, though, I mean, come on, it's a little quick on Archer's part, right? Kind of like he was just waiting there the whole time to strike, just circling like a shark.
Okay, he's not a shark. We were broken up, and they were consenting adults.
Just saying. Let him. Let him. Dun, 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 dun.
I have a patient. Okay, Miles Weller. I'm Dr. Ripley, and you've been experiencing some leg pain.
And a fever?
It's nothing. I went swimming in the lake a couple nights ago, probably caught a cold. Just a little achy, but she worries.
Well, I can't have you dying on me before the wedding.
You two are getting married?
That's why we're out on the lake. I was proposing.
Congratulations.
My mom is gonna freak, marrying a guy I only met a month ago.
We met in person a month ago. We've been together for over a year.
Online?
It's crazy, right?
Well, crazy worked. Now let's take a look at these legs.
scars look pretty swollen.
Yeah, I was in a pretty bad car accident recently. That's why it took so long for us to meet. They had to rebuild both my legs, 2 different surgeries. Last one was 3 months ago.
Well, they look pretty infected. Would explain the discomfort and the fever. But we'll get an x-ray and some blood work to find out for sure, okay?
See? Listen to your almost wife.
Please, I need help.
What is it?
We were walking in and this car pulled up and dumped this kid on the sidewalk. He's diaphoretic.
Diaphoretic? Kid, how old are you?
That's what Will said.
Will who? Who are we talking about?
Dr. Halstead?
Which room's open?
Dr. Halstead.
Sorry. What'd you say, Miss Goodwin?
Oh, I was just seeing how you're doing. Is there anything I can get you?
Dean, what the hell's going on? It's been forever.
Okay, we had to resect multiple sections of bowel and mobilize his colon, but I'm pretty confident that he won't experience any long-term deficits from those injuries.
Those injuries. There's more?
The bullet did some damage to his kidneys, unfortunately. I mean, the right one was effectively obliterated.
But the left is okay, though, right?
Well, yes and no. It seems Owen's got a congenital abnormality called horseshoe kidney. You aware of that?
No, I was not.
Horseshoe.
Yes, instead of having 2 discrete kidneys, Owen's are connected by, I guess you'd say, an isthmus of tissue, common blood supply. We've already removed the right kidney, and we're trying to ensure that the left is perfused and functional with the remnant blood supply. So that's where we're at. I just wanted to give you an update.
Thank you, Dean.
Sure.
Okay, so do we know if Natalie's on her way?
She's on a red eye, yeah.
Daniel? What are you doing here?
I'm picking you up.
I haven't been able to reach Will yet. To get an update on Owen.
Hey, look, I just talked to Sharon, okay? Owen's still in surgery, but it's going well.
He's still in surgery.
It's Dean, okay? He's in excellent hands. Listen, we're gonna get Owen through this, all right? Gonna make sure that you all get through this. Call Will.
Is Dean still working on that kid?
Yeah, must be one hell of a mess. So how'd it feel, staring down the barrel of the gun?
Yeah, only the 2nd time in a year. Wish I could say I'd gotten used to it.
You ever feel like maybe it's you?
You know, not until you just said that. Thank you so much.
You're welcome.
Meanwhile, man, Lennox, on the other hand, didn't even register. Like, she didn't care if she got shot or not.
Well, she's a combat vet. They're built different.
Maybe.
Couple of MVC Vicks. 1 is in pretty bad shape. Traumas 2 and 3 are ready to go.
Dr. Frost, you with me?
Absolutely.
Julie Wheeler, 32, went with the windshield. Scout black with a GCS of 3, EPs 150 over 76, airway secured with an eye gel.
He and his partner got plowed into by an 18-wheeler.
On my count, 1, 2, 3. Go get the other intake.
On it. All right, talk to me, guys.
Corey Graham, restrained driver, airbag deployed, GCS of 15.
Heart rate 93, BP 130 over 80, hasn't complained of much pain.
Okay. Transfer on 3. 1, 2, 3.
The truck's first, so suddenly there's nothing I could do.
Okay, Corey, I'm Dr. Frost. I'm gonna take good care of you, okay? Just relax.
How's Julie? I need to see him.
Whoa, we're gonna have to have you sit still until we clear your C-spine, okay?
Journal rub?
No response.
What's going on in there? I can't see. You shouldn't be alone.
Corey, look, Dr. Lennox is gonna take good care of him in there, okay?
I'm right here, baby. Can you hear me? You gotta tell me you're okay, Julian. Help him.
I should have just taken him to the game like I promised.
No.
stop blaming yourself.
If Owen doesn't pull through, I will never forgive myself.
There you are.
Hey.
Hannah. Any more updates from Dean?
Not since we last spoke. I'm so sorry.
I need to see my son.
All right, yeah.
I think your doorbell's
It
broken.
worked fine. I was sleeping. What happened to your key?
I lost it. You were sleeping? Since when do you sleep past 6?
Since when are you up before noon? And what's with the suit? Was this a Halloween costume?
This is 100% polyester, I'll have you know.
That's not good.
It's for work. Wait, you got a bike?
Yeah, I got a bike. Sorry, you got a job that requires you to wear something besides a ratty t-shirt?
Well, I see that you're currently enjoying one of my ratty
I don't
old
want to miss the
t-shirts.
breakfast rush. Hey,
What's up?
dude. Look, I didn't know. I thought she was single.
Oh,
Ew,
no.
I'm her
no,
brother.
No.
Oh, well, cool. Nice to meet you, man.
Yeah.
Have you seen my pants?
I think they're by the couch.
Thanks. Just gonna use the bathroom.
Aye, aye, Captain.
Impulse buy?
No, what are you even doing here, Kip?
Oh, so, do you still have Mom's ring? I, kind of got some important news. Might want to sit down for this. Okay. I am proposing to my girlfriend.
Oh, how far along is she?
Seriously, Katie, Gemma is the most amazing person on the planet. We're hanging out in Andersonville tonight. You should stop by and meet her.
Guess I'll be heading out then.
Oh, get out.
All right.
Quick eats? Or is this like a quickie? Hell of a tip.
Kip.
What? I'm happy for both of you. Sex makes the world go round.
Yeah, sometimes I get to meet some pretty cool people.
So do you have Mom's ring, or are you gonna save it for the delivery, dude?
So it's just the ultrasound today, right?
Yeah. Hi. I'm Dr. Lavelle. Dr. Clark had to step out to do a delivery, so I'm going to be doing your ultrasound today, okay?
Okay, yeah, sure.
Before we get started, 2 very important questions. Question number 1, do either of you know who I'm supposed to be?
A cat.
I'm the cat that went viral for looking like Eugene Levy. Remember he had those funny markings on his fur like eyebrows?
Oh, I'm not really active on
Facebook.
Instagram. So.
It's time to move on to TikTok. Anyway. Question 2, do we want to learn the baby's sex today?
Yes,
I'd
we
rather
would.
not.
So, I was kind of thinking it would be nice if we kept it a surprise.
Oh, you really think we need any more surprises?
I mean, why is learning the sex so important?
I mean, it would help to figure out the design of the nursery.
You could always do a gender-neutral theme. Outer space, the ocean, woodland creatures.
Oh, yes, those are great ideas. Thanks.
Yeah, I'm really not worried about the nursery.
Okay, well, then we'll just revisit it at our next visit.
I'll make a note for Dr. Clark. Are you ready?
All right. Okay.
Knock, knock. We were supposed to meet at Lou Mitchell's for breakfast this morning, birthday boy.
Look, you get my text? I'm so sorry. I can't do it today. This day's turned into an actual freaking nightmare. I'm so sorry.
Yeah, we got your text. We chose to ignore it.
Did you really think we were gonna let you wriggle away from any and all humiliation?
Do your colleagues realize how old you are? Oh, hey! This guy is 65 today. Tell a friend.
Would you have a lighter by any chance?
Almost forgot
Not
your
that
present.
I smoke, but
Oh, this was
Oh, look,
obviously Howie's idea.
Ta-da!
Whoa!
Oh, here we go.
Jeepers. Guys, they're gorgeous. Are they fancy? That's my name. Guys, I don't even play golf.
Not yet, you don't.
You're always talking about how the ED is a young person's game. Certainly, you must be getting tired of fighting the same old fight.
Make a wish.
Not even 9 a.m. and we're already getting Halloween injuries. So glad I'm off tonight.
Big plans?
Sadie and I are taking Amelia trick-or-treating.
Really? Well, so that's kind of turned into a bit of a thing?
Yeah, a really nice thing.
Dr. Ripley, you're on deck going to treatment 4. 8-year-old boy fell down at school, trauma to the face. Teacher rode in with him.
Sorry, pal. No rest for the weary.
Actually, Dr. Charles, you're needed too. It's a possible psych issue.
Oh, trick or treat.
Lucas Early, 8-year-old male. 2 centimeter through and through laceration middle of the lip. Lower 2 front teeth went through the skin.
It's okay, Lucas.
This is his teacher, Miss Herrera.
You're safe. These doctors are gonna help you.
How did this happen?
He was running, tripped and hit his chin on a curb.
Okay. Hi, Lucas. I'm Dr. Ripley. We're gonna take you for a little ride, okay? On my count, 1, 2, 3. Lucas, you mind if I move this jacket a little just so I can take a look?
It might take him a minute to warm up.
Did he get overstimulated by all the Halloween costumes?
Northbrook doesn't allow costumes at school. Could I speak with one of you outside?
Of course.
Thanks, guys.
Lucas, I don't even know what to call it. He became extremely agitated and tried running away from school. Thank God he tripped. Northbrook Academy is on a very busy road. If he had run into the street, I don't know what would have happened.
I swear, are you aware that you're bleeding?
What? It's just a small cut. I didn't think it was that bad.
What happened?
Get away!
Lucas, I'm not gonna hurt you, okay? I'm a doctor. I'm here to
No,
help.
you're not a doctor. You're one of the bad people.
The bad people?
The monsters. You're all monsters.
Oh, sorry, man. I didn't realize anyone was in here. I just thought I left my phone charger in here yesterday.
No, it's all good. My shift starts in a few minutes anyway, so.
Wait, did you sleep here last night?
What? No. No, I caught all the lights on the way in, so thought I'd get a few extra minutes of shut-eye before my shift.
Man, I wish I could fall asleep that fast.
What can I say? We're not all born with a gift, right?
People lie. They hide their true feelings, and sometimes they don't even know how to express those feelings. As psychiatrists, we are relying on our own personal assessments, which are riddled with mistakes and biases. And unlike other medical disciplines, we base our treatments on conversation and observation. Nothing more.
Oh, come on. It's a bit of a reductive assessment of what we do, isn't it?
But is it? What other tools do most psychiatrists employ?
We use any number of clinical tools, but as aids to our initial assessment. I mean, it sounds like you're proposing that we lead with this stuff. You want me to let a machine tell me what's going on with my patient?
No, I am proposing that we endeavor to give patients effective and efficient care. In a world where there's constant pressure to increase patient turnover rates, where there's so little time, we can rely on fMRI to help doctors instantly diagnose bipolar disorder, depression, schizophrenia, and we can push psychiatry into a true science where we replace the guesswork with hard facts.
The guesswork.
I'm only referring to certain types of...
Right. Okay, look, first of all, from what I've read, fMRI, diagnostically speaking anyway, according to the statistics, it's just not there yet. But even if it was, a lot of the psych patients coming into my ED are experiencing their first episode. You know, their initial set of symptoms, and they're disoriented. Sometimes they're terrified. They don't even know they're psych patients yet. And what they need in that moment, more than anything, is human contact. Right? Empathy? Compassion?
I am not trying to challenge your methods. Trust me when I tell you that in addition to its efficiency, there is a tremendous amount of potential in this tech. And I would love nothing more than to continue my research right here at Gaffney with you.
How we doing, Cora?
Pretty good.
She's coughing a lot.
I'll order another albuterol nebulizer. That should help. Doing okay? I know the first few days in the isolator takes some getting used to.
I keep thinking about this pet fish I had in kindergarten.
Octavio.
Yeah. I used to stare at him in his little fishbowl. Seems so cozy with his castle and treasure chest. Doesn't seem so cozy now.
Look, I know it's not ideal, but this is the best way to keep you safe. Your immune deficiency disorder means that your body can't protect itself from infection. But inside the fishbowl, no germs can get in, so all you have to worry about is getting better.
Okay.
I mean, plus, it doesn't feel cozy in there because you haven't done any decorating yet.
Decorating?
Yeah. I mean, I'm thinking some curtains in here, maybe a few Blackpink posters, huh?
You're being sarcastic.
Maybe a little. But it doesn't mean we can't find ways to make you feel more at home, okay? So how about we both think on it?
Okay.
She's getting worse, isn't she?
Our blood pressure is dropping and lactate is rising, which are markers for sepsis. But the only thing that's going to make her better in the long term is a stem cell transplant.
Any word on the test results?
There's nothing from the registry. And your test results aren't back yet, but I will let you know as soon as I hear.
But if I am a match with Cora, how soon can we do the stem cell transplant?
And hopefully within hours.
I don't understand how this happened so fast. She was such a healthy girl, and then suddenly these past few months. When I decided to have her on my own through IVF, I was so scared. But then she arrived, and all the worry went away because she was perfect. And we were perfect. Just the two of us.
Help! Someone!
What's going on?
They said to bring it. I kept it cold.
Oh my God! What is it?
Lionel Blake, 37-year-old male, left hand severed off in a circular saw accident at a shop.
The heart rate's 126, BP's 95 over 54. Coworker found him, used his belt as a tourniquet till we got there.
Complete amputation? How much blood was there at the scene?
A lot. And we got the hand.
All right, we'll get it in a sterile bag.
Okay, I'm on it.
All right, on my count. Ready? 1, 2, 3. Oh, hurts. 100 mics of fentanyl. Let's get a cardio monitor and oxygen, and let's get another IV and hang a unit of...
Oh, negative. Got it.
You are going to surgery, Mr. Blake. Page hand and vascular, please. We need help getting this hand reattached.
Wait.
No. Lie back down, sir. Lie back down.
Please let me go.
Blake, come on now.
You don't understand.
What don't I understand, sir?
I don't want it reattached.
Excuse me?
I cut it off on purpose.
All right. Are you saying I'm your dream girl?
Yes, ma'am.
Where's David?
In his room with the door closed.
David, we're sitting down to dinner, son.
All right. Is everybody ready for highs and lows of the day?
Michael, hand that over. I will tape this for our future self.
Okay, and why don't we start with you, baby girl?
Well, my low was when I had to read my book report to the whole class. My high was finishing it.
Oh, okay.
Good. Facing our fears helps us grow. Michael.
Well, mine was hitting a triple off Darnell Brown today at baseball.
Nice job. And lows?
No low with skills like that.
Oh,
my man.
okay. What about you, David? Highs and lows of the day?
I don't feel like playing today.
Bad day. Here, I'll take that.
Bad days help us appreciate our good days. Tomorrow will be better. I promise, huh? Okay.
Well, I don't know about you guys, but I am starving. Let's eat.
I'm going in for a roll. So we pass the butter.
comfortable? Would you like some water?
Hey, Ma, why don't you take a break? You need to eat.
I will when Dr. Archer comes with your father's CT results.
I'll go get you some coffee to hold you over.
Okay.
David!
Who
made it?
Of course I did. It's Dad. It's been a minute, bro. Hey.
Why didn't you give me your flight info? I would have come to pick you up.
I'm a big boy, and you have enough on your plate. Hey, Dad. How are you?
He doesn't talk that much anymore.
Right.
I'm sure it must be a shock for you to see your father like this.
It hasn't been that long. I saw him when he moved into the nursing home.
Well, that was over a year ago.
That can't be right.
Well, the important thing is that you're here now.
Hey.
Son?
Yeah. I'm here, Dad, yeah.
Now, how did you get a piece of plastic in your eye, Maisie?
My name's not Maisie. It's Kara Zor-El. But you can call me Supergirl.
Well, my bad, Supergirl.
She snapped a plastic hanger with her bare hands. This is the Halloween costume that just keeps giving.
Well, luckily it wasn't made of kryptonite, because then we'd be in real trouble, huh?
Doesn't scare me.
All right, do me a favor and look up for me, Supergirl. Take a look at that.
Wait, you used to be an actor, right?
Yeah, no, back in the day.
Yeah, on that show with the girl with the dead dad who's desperate to lose her virginity to you. She keeps fantasizing about you ripping off your shirt. You still got those sweet abs?
Actually, I think you might be mixing me up with someone else. My show was about two teens who traveled through time together with a magic backpack. Nick of time?
Doesn't ring a bell.
No worries. I'll go get the discharge started, okay? See you, Supergirl.
Do you still have those sweet apps?
Ah, you heard that.
Every word. Made my day.
Great.
How often do you get recognized?
Well, I'd say it's like 2-3 times a week. Definitely beats my life when the show was still on. Yeah.
Feels like malls would have been an especially bad idea for you.
Yeah, no, that I would get mobbed, chased. It was insane.
I'd pay to go back in time to see that.
But, you know, I still have my backpack from the show if you want to try it on. Hey, do you want to have dinner tonight?
That sounds nice, but
But what?
well, we work together.
Yeah. Right. I didn't realize you...
Oh, no, I know. Totally. And it's not that I don't want to.
Really, there's no need to explain. I get it. It's cool. What do we got?
Adrian Montag, 12 years old, right lower extremity deformity after falling 10 feet. It's tender and swollen.
Trauma 2?
Copy. Heart rate 110, BP 115 over 76. Sat 98 also has multiple hornet stings.
Hornet stings?
Me and Lexi found the nest up in our treehouse. Tried to knock it down with a stick, but then they were everywhere.
Because Adrian felt he didn't catch too many stings, but Lexi was not so lucky.
Damn, okay, let's get 2 milligrams of epi and then an x-ray.
Where's Lexi?
She's in the ambulance behind us with her mom.
She can be okay?
Look, Adrian, I promise that we're gonna take very good care of Lexi when she gets here, okay?
It's all my fault. She told me not to hit the nest and I didn't listen.
Ready to transfer?
On 3, 1, 2, 3.
We're bringing her in now.
Okay, keep him MPO and let's get a trauma lab panel. I'll be right back, all right?
She's in respiratory distress. I'll intubate.
Is my baby gonna be okay?
Let's let the doctors work this, Captain. Intubation meds are in.
She must have been stung 50 times.
Heart rate 150, BP 90 over 50.
O2 stats 80.
Damn it. I need more cry pressure.
Not enough airflow?
Oh, it's really hard to see the cords. Has to be bougie?
Right, stats down to 73.
Damn it, no time. I need to cry her.
She's asystole. 0.5 milligrams of epi. Starting compressions. Got it?
Yeah.
Pulse check.
Still nothing. 1 amp bicard.
Please don't let her die!
What is it? Go get your brothers. It's okay, Bert. We're all here.
Izzy, what do we do?
Just be here. It's okay. It's okay, babe. It's okay.
Miss Goodwin,
Tamika.
how you doing? There was a lot of people at the funeral.
Yeah.
I'm happy to help you pack up once I finish my rounds.
Oh, don't feel obliged, but I'll take the company.
Okay.
Well, your BP's slightly elevated, but that doesn't explain your panic attack and nosebleeds.
Well, what are we looking at then?
As you know, when you get older, your body's ability to metabolize medication decreases.
Yep.
I think that the antidepressants you're on are not being properly metabolized, and they're building up in your system.
This cocktail's been working very well for me, okay? It was not easy to dial in. I know that I'm having some issues, but how do we know that they're not temporary, or even unrelated? I'm just saying it's a very big call to make.
I know, and it's a conversation you have to have with your therapist, but if it were my call, I would have you titrate down for a few weeks and see if your symptoms abate.
I love you truly,
So your musical friend is back?
I like him because he drowns out the construction.
Which, God willing, should be completed in the next 2 days.
I'm impressed you made it here on time, considering when you got home.
My body is here, but my soul is drowning in Goldschlager from last night.
Nice reunion, then, with your Nick of Time co-star?
I don't know what I was thinking going drink for drink with Ian when he's always had a wooden leg or like a second liver.
What's he in town for?
OtCon. It's a convention for early 2000s pop culture. A lot of actors that run shows back then go and sign autographs, take pictures, blah, blah, blah.
Does that include Gilmore Girls?
What?
Nothing.
Seriously, though, okay? What are the chances that nobody in Chicago gets sick today?
Right, incoming MVC, 3 patients, all hands on deck.
Okay.
We got Matt, Sebastian Hendricks, 20, got into an accident with a cab on the Kennedy. Both cars going 60. Sebastian spun into the divider.
Mr. Hendricks, I'm Dr. Archer. How you feeling?
I'm okay, thanks.
Treatment 5. BP 125/82. Possible humerus fracture with some small lacerations from the glass.
I guess the airbags did their job.
It wasn't a goddamn accident! He tried to kill us!
Yeah, we're gonna have you laid back, please.
It's okay, we're gonna help you. Louisa Sweeney, 9 months pregnant and in active labor. She was in a cab on her way to the hospital when the other car hit them.
Is my baby okay?
BP 126/72, attack you 30s.
It looks like she busted her tibia. I had to yank her out of the car.
Please, what is happening with my baby?
We're going to figure that out. Transferring 1, 2, 3. Okay, let's start the meter of fluid, get the neonatal pad, find the fetal monitor, ultrasound.
Oh,
Okay. Angelo Reyes, heart rate 82, but BP 74 over 58.
Trauma 2, Casey.
Got 2 units of uncross-matched blood and a chest and pelvis x-ray.
He took the brunt of the impact. Hasn't moved his arms or legs since we got him.
Could be neurogenic shock. Mr. Reyes, can you feel this?
No.
How about here? Mr. Reyes?
Heart rate 46, BP crashing.
Start levofed. Let's get ready to intubate. Transfer on my count. 1, 2, 3.
Are they gonna be okay?
Mr. Hendricks, I just need you to focus. Focus your eyes on my finger.
Where's my phone? I need to call my parents.
Luisa, we need to roll you onto your side to deliver since we can't bend your broken leg, okay?
Stabilize the leg.
Okay, on my count, 1, 2, go!
Easy.
Okay, here we go.
What? You want me to push like this?
Call the sideline birth, I promise you it's safe. Right, baby's having D-cells with contractions. Okay, we need to get this baby out now. I want you to push, Luisa. Grab the OB kit. Okay, deep breath.
Levofed's at 30 vitals, still tanking.
How many milligram of epi and start a second drip?
It's not helping.
Ready the crash cart?
Now! Yeah, I got him.
Is he okay?
Just need to get him checked out. But the screaming's good. Here we go.
Welcome to the world, little man.
Hannah!
She's lost too much blood. Doctor, pressure's dropping.
Bleeding out.
Go, Glow!
Dr. Wu!
She's hemorrhaging!
Jeremy Lockhart, 32-year-old male with gastric adenocarcinoma, complaining of severe abdominal pain, persistent vomiting, and hematemesis.
Started a liter of normal saline in the ambo. Heart rate's 140, BP's 115 over 72. And this is his wife, Esme.
When did he start to vomit?
Around 2 a.m. I called 911 as soon as I saw blood.
So you're under the care of Dr. Kingston, surgical oncology. Thanks.
Yes, that's right.
All right, everybody. On my count. Ready? 1, 2, 3. All right, let's start with 4 of Zofran and 50 of fentanyl.
On it. Jeremy's on a chemo regimen of 5 fluorouracil and cisplatin. Just finished his last cycle on Friday. Everything was going smoothly until last night.
Yeah, I've actually tolerated this combo way better than the last one.
Esme? Jeremy. Dr. Asher.
You all know each other?
Yeah, long story short, Dr. Asher's been my own personal guardian angel.
How you holding up?
I've been better, but so long as the chemo keeps doing its job, I can take it.
Let's get a full set of labs and type and cross 2 and 2 and an abdominal CT. Thanks. I'll call Dr. Kingston, let her know you're here.
Can I get you anything, Esme? A cup of tea?
I'm all right.
Okay, I'll check back soon.
Thanks.
Dr. Charles, got a minute?
Yeah.
Patient in 4, Angelica Larson. She broke her ankle during a gymnastics competition. In the middle of her beam routine, said she got dizzy, couldn't see straight.
Hate it when that happens.
Yeah. I ran a full workup of all the usual suspects. Everything came back normal.
But you think there's a psych issue?
Angelica has been on this new anti-anxiety medication the past year. It's Bomaline.
Oh, I've heard of it. I mean, it's supposed to be a good drug, but isn't it still in trials?
It is. Angelica was a phase 2 participant, and she was allowed to continue on the drug after her trial ended under the supervision of one of the study's co-PIs, Dr. Theo Ribari.
I know Theo. He's here at Med. He's doing some research. I invited him.
Yeah, well, that's why her mom brought her into Med. They were concerned she might be experiencing some new side effects.
Okay. I'll loop him in.
Thanks. Hey, Novak. Wow, it's really coming down out there, huh?
Ah, must be nice to be holed up at Club Med on a day like this in your warm pajamas.
Can't lie, it is pretty snug.
You hit up a rave last night?
That is from one of my patients. Yeah, she's a gymnast, so that apparently means a lot of sparkles.
Sure.
Do I look like a raver to you?
I mean, there was that rumor you're on meth, so.
What? Nothing. Yeah, you'll be shocked to find that I'm not, so
Good. Yeah, I would hate to see you mess up those veneers.
why do you think I have veneers?
I thought everyone in Hollywood had them.
All natural now. But my ass, on the other hand, that's BBL all the way.
Doc did good work. I should go.
Can I maybe grab your number?
Do you have a pen?
Pen. It's very old school. I like it. Here we go.
Didn't think it would be that easy, did you?
East Mercy's dealing with some flooding in their ED, and their ambulances are going to be diverted to us and Lakeshore Memorial.
Lucky us.
Our latest shipment of IV fluids is delayed. We got one CT down, and construction and treatment 7 hit yet another snag.
Do you have any good news to share?
No, not really.
Have we resorted to medieval torture? What's going on in there?
Some kind of electrical injury?
What happened?
He was working on a down power line and it tripped his defibrillator. Now it keeps shocking him.
Dr. Ripley, the magnet isn't disabling the defibrillator. The eschar from the burn's preventing it from working.
His pressure's dropping.
Call cardiology. We need their CID programmer.
There's no time. His heart can't take much more of this. The next arrhythmia could kill him. Who are you?
Lena Martinez, third-year medical student.
That's great. Please move.
Excuse me,
Now, give me 10 cc's of 1% lidocaine
What are you thinking?
Here's Lido.
Dr. Lennox,
and a scalpel.
you want to fill me in on... Whoa, 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 whoa. What are you doing?
I got it.
Are you okay?
I'm fine. Put pressure on the wound. Now you can call cardiology.
Don't ever do that.
Daniel?
I don't know what's wrong with me today. I guess I'm not feeling that introspective. I'm sorry.
It's your dime. How about, anything in the news catch your eye, book you're reading?
Things got pretty crazy at work yesterday, that's for sure.
How so?
Well, we lost power. Got tricky, people fumbling around in the dark. I think it kind of got into some people's heads.
Did it get in yours?
So this surgery was intended to palliate the symptoms Jeremy presented with?
That was the intent, yes.
And had the debulking gone off without a hitch, how many more years of life expectancy would Jeremy have enjoyed?
Years? We were maybe hoping for a few more weeks.
A few weeks? That's not protocol, is it? I mean, to risk a potentially fatal surgical outcome for such a marginal improvement?
Some extenuating circumstances led us to adjust the calculus.
Such as?
Such as Mr. Lockhart's wife, Esme, being pregnant with their first child. Jeremy had expressed a desire to be there when the baby was born before he died.
And their baby couldn't be delivered safely in that time frame?
She was only at 31 weeks, so no.
So did this same calculus lead you to make the decision you did when the power went out?
Dr. Lennox, I'm Detective Gonzi Orrick. Sorry for keeping you. I would like to go over your statement.
Is this really necessary? I'm very tired.
I appreciate that, but I find that people's memories get a little wiggy if you wait too long. I'm not sure if there's a medical term for that or not.
It's called consolidation. Short-term memories get transferred from the hippocampus to the cortex for long-term storage, and yes, some leakage tends to occur.
It's good to know. There's some science behind it. Anyway, as I was saying, why don't you just walk me through what you were thinking when you left the hospital yesterday?
Thinking?
Well, you told my deputy that you were concerned that Mrs. Carter was in some kind of trouble, and that's why you went over there.
Yes.
So why didn't you call the police?
I don't know.
You don't know? You don't remember her? Might that have leaked out somewhere between the cortex and the hippo, whatever?
Well, maybe I didn't call the police because I was concerned that they wouldn't take this as seriously as I did.
On the other hand, had you notified the authorities, maybe someone wouldn't have wound up dead.
All I'm asking is next time you're hosting folks at our place, just give me a heads up, okay?
Wait, you just said our place. Rip, bring it in, man. You're gonna make me cry.
Did you hear what I said?
Hey. Thanks again for letting us use your apartment for poker nights.
Yeah. Actually, Doris, it's our place now.
Oh, how cute.
Yeah.
Where are you two registered? Oh, heads up, Novak and Violet are 10 minutes out with a college basketball player. Injured her knee during their morning game.
I can take it.
I wonder why he's so eager.
Could it have something to do with a certain paramedic?
Yeah, or because I'm just a really good doctor. So, yeah.
Is that it?
No.
No.
I'm going to take you up for an MRI shortly, Mr. Riley. You got any metal on you?
Nope. Oh, wait, yes, there is.
Okay, what, a wedding band, a wristwatch?
It's not really on me, it's, in me.
Okay, pacemaker, piercing?
No.
Where... Is it in your rectum?
My what?
Is it up your butt?
Yes.
Okay, and what is up your butt?
It's a...
I'm sorry, I didn't catch that.
He said a plug, Dr. Archer, like a butt plug.
We were trying a new position when I fell off the bed. And my girlfriend, it was her idea. She's
okay.
She thought I might...
Yeah, sure.
I'd taken it myself.
No, that's why I'm here. All right. Let's roll Mr. Riley onto his side.
What do we got?
Oh, this is real white glove service. Most docs wouldn't walk the extra 10 feet.
Well, not most docs.
We've got Kristen Thompson, 21-year-old female, pain and swelling to the left knee after a sudden stop and change in direction.
It's my ACL. I know I tore it. I heard the pop.
Okay, we're going to treatment 5. Right this way.
We have 50 mics of fentanyl in the field.
A scout from the sky is coming to our next game. No chance I'm gonna be able to play.
Hey, let's not get ahead of ourselves until we know what's going on, okay?
Good morning.
Oh, hello.
What you got there?
It's,
No.
nothing. So, what brings you to our humble department?
Well, I seem to recall that you were telling me it's sacrilege that I haven't been to the Green Mill yet.
Well, as a so-called jazz enthusiast, absolutely.
So I plan on rectifying that this evening.
Oh, well, that's great to hear. You should try to get them to seat you in Al Capone's old spot. You might need to invite a friend or two to help you snag his booth, but,
You know, I had someone special in mind.
Oh, well, that's great. Whoever they are, they're gonna have a great time.
It's you, Dean. I'm asking you out.
Okay. Sorry, I'm a little,
Slow on the uptake?
and rusty.
I am gonna sneak in a quick coffee run before our next call. Do either of you guys want anything from the cafe?
I'm good, thanks.
I'll take a caramel frappe. Mm-hmm. Oh, this is cinnamon roll.
She has the metabolism of a teenager. It's insane. Okay.
So yeah, that sweet tooth, huh?
Sweet, salty, umami. I don't discriminate.
Nice. Well, you should check out my buddy Frankie's new donut stand down at Navy Pier. It's got some wild flavors. Bacon, maple, dill pickle, mango chili lime.
Sold. When are we going?
How about tonight?
Dr. Frost, need some help in here. Said she was feeling sleepy, then suddenly her sats started dropping.
Okay, let's get her on oxygen and a cardiac monitor. Hey, Kristen, wake up. Wake up, Kristen.
Okay, what's going on here?
No clue. She came in with a suspected ACL injury, shallow respirations.
Okay, you brought her in?
Yeah. She was fine in the ambo, alert and oriented.
She hit her head or lose consciousness at any point?
Mm-mm.
Yeah. People's are pinpoint.
She's ODing.
What?
Sats are down to 82, heart rate's 40.
All right, bag her and get me Narcan fast, please.
Good morning.
This is a lot of hoopla just to go kiss the ring of our majority owner.
Well, I'm hearing whispers this meeting isn't just a formality. Apparently, he's not happy with last year's profits.
Well, if they want to cut costs, they could start by not chartering a jet to Jackson Hole.
Yeah, well, maybe don't lead with that.
I could talk to Miranda, see if we could go in with a unified plan.
I don't have time to explain your mistake to your boss. I'm already late.
Looks like she's in a good mood.
Should probably go to work.
Your feet aren't moving.
It's weird, right?
You're probably coming down with something. You should call off work.
Yeah, maybe. Sorry, can I help you?
You look like a doctor.
Thanks. So do you.
Well, I'm a med student. I'm looking for Dr. Charles. I'm supposed to meet him in the ED, but I keep getting turned around.
All right. Yeah, I'm actually headed in, so I could take you to him. Wanna pick this up later?
Yeah, I will text you takeout options.
Okay.
She seems nice.
She's great.
Man, med students just keep getting younger every year. They look like they're in high school. They're first years. First years? What are they doing here?
You remember my friend Howie?
Of course, yeah. I'm sorry about his wife. I know how close you were.
Yeah, well, thanks. Anyway, Howie is on the faculty of the med school at Porter University, right? As you might know, there's a shortage of mental health workers in this country. So Howie identified a few students who are interested in psych, asked me to come talk to him.
Oh, but that wasn't good enough.
No, it wasn't, because I'm a lazy ass, so I made him come to me.
Dr. Charles, this is Mira. She's been looking for you.
Mira, what a pleasure to meet you. I was just on the way to say hi to your friends.
Oh, they're not my friends. I don't really have friends at school yet.
Oh, no? Well, who knows? Maybe by the end of the day, that will have changed.
How are we doing?
Not as good as you, judging by that lipstick on your neck.
That explains why security keeps high-fiving me today. Okay. Sorry. Sorry, it's spam. What were you saying?
Just that it looks like it's getting hot and heavy with you and Nova.
Yeah, it's definitely hot. Don't know about heavy. She's not super into talking about personal stuff.
Thoughts?
What is it with these men wanting emotional intimacy? Can you not just be happy that you're having sex in a parking lot?
That's oddly specific.
Treatment 3.
If we have specific questions about procedure, is it okay?
Fire away anytime, Sabrina. Yo, TikTok, what's up? Stay with me, Quentin, okay?
100%. I'm stoked, boss.
So do you use structured protocols for triage here, or are you more focused on rapid assessment for better crisis
That's
intervention?
an excellent question.
Should we all be taking notes?
You know what? My only wish is at the end of the day, you guys have a much clearer idea of what this specialty is about.
Somebody please help us!
Our son was shot! Please help him!
Let's give him some room.
Trauma 3 is open. It's over here.
What happened?
We were just walking to a speech therapy appointment.
One wound under the right collarbone, second wound just below the tip of the scapula, subclavian trajectory.
We were waiting at the light. There were these two guys. One put out a gun, and we just heard a loud pop.
Decreased right radial pulse. Let's get blood in the room.
Copy.
Is he gonna be okay? Billy?
Hey, Dr. Morgan, you guys need to wait outside.
Yes, I promise we're gonna take good care of him, okay?
I'll get the Cordis in. We need to intubate. Let's call the blood bank and move MTP to the OR.
Copy.
Billy.
I got him. He's gonna be okay.
2 grams of TXA, 1 gram of Ansep, and let's get ready to X-ray.
On it.
Hi. I'm just looking for a couple of guests, James and Celeste Frost.
I'm sorry, I'm not seeing anyone staying here under that name.
Oh, well, maybe you could just check again.
Jonathan Michael?
Hi! Hey. Sorry, you never told me what room you were staying in.
Well, that's because your father and I are actually staying in the hotel.
Oh.
Can I come inside?
Sure, yeah.
Great.
Hey, what are you doing on the 7th floor?
Getting a new badge. Must have misplaced my old one somewhere. Not crazy about the photo. Thoughts?
Do you ever take a bad photo?
That was thirsty, and cloying. Why do I like it?
You like to push the boundaries, don't you?
Just finding out where yours are.
Sometimes I wonder if you're hoping we get caught.
Oh, I'm by no means looking for this relationship to become public.
And while New Year's Eve might be the busiest day of the year in most EDs, we all here in Chicago know that that honor belongs to St. Patrick's Day. So look alive, stay alert, and may the road rise up to meet us all.
Or at least be free of potholes.
You're not eating your breakfast.
Your mother made that schemano special, you know.
It's great, Mom, really. I'm just not very hungry right now.
Okay.
Can't believe you guys actually sold the house.
We decided to downsize once the money stopped coming in.
We didn't want you worrying about us. Your father and I are doing fine.
Even if the smell of your mother's cooking does tend to linger.
Okay, I'll open the window.
Taking off again tomorrow, by the way. Go see the Brandywine Falls.
Yeah, you should join us.
No, I gotta work, so.
Oh, come on. When was the last time we all took a road trip together?
Laguna, when Jonathan was still a teenager. You know, I still have that photo album around here.
Dad, I don't know if you should be doing any hiking with the MS and all, you know?
I'm not a complete invalid.
Found it. You kept begging us to go to the beach. I think you were looking to see that MTV star. What was her name? Elsie?
Never could dissuade you from doing whatever you wanted.
There we go.
Oh, I love that car. Whatever happened to her?
Well, you totaled it on PCH. Cost me a fortune to buy you guys out of the lease. You know, and just to be clear, you know, we didn't go to Laguna that day because I begged you. We went because you pulled me off set during contract negotiations.
I don't recall any of that.
I know. Yeah. I had dug a $50 hole in my scalp because of the stress. You know, and they had to put the fake hairspray in it to cover up the hole until it filled in.
Well, we got you the raise you were looking for.
The raise you were looking for. The whole crew hated me for it. You made me a pariah.
Aren't you being a little histrionic?
You know, it's really, really always great seeing both of you, I gotta say. I have to get to work, but hey, we should do this again sometime, right?
Jonathan, Michael.
Thank you for breakfast.
You can't just leave like this.
Let him go, Celeste. He's having one of his tantrums.
I mean, facts are facts, right? There is such thing as an objective truth.
Okay, hold still, would you?
I don't know, maybe there's just too much water under that bridge.
Okay, that should do it.
Hey, you with us today or not, Dr. Frost?
Yes. Thank you again. What do you got for me?
Trauma 1, 40-year-old female brought in from Kenton with multiple lacerations, self-inflicted.
Kenton, the mental health facility?
Yeah, schizophrenia. I already paged Dr. Charles.
Wake up! They are using the 5G towers to mutate! You can't hide! None of us can hide!
The orderly found some kind of shank in her quarters that she fashioned out of a toothbrush. We're lucky she didn't do more damage to herself.
Counting 5 slashes here, 3 shallow and superficial, 2 penetrated past the dermis.
You better run! I cannot protect you! I cannot!
Give her anything back again?
5 milligrams of Haldol.
Let's give her 5 more. 25 of Haldol? What is her regular regimen?
For the past 3 years, she's been on clozapine, 200 milligrams twice daily, admittedly with increasing less efficacy.
How about before that?
She's been a patient at Kenton for close to 20 years now, mostly before my employ. I'd have to review her charts. I can forward them to you if you like.
Oh, thank you. I'd appreciate that.
Haldol's in.
Emily, I'm Dr. Charles. This is Dr. Frost, and he's trying to patch you up so we can get you back to full strength.
Can he be trusted?
He absolutely can, but in order for him to do his work, we need you to stay still. You think you can do that for us?
Okay.
Great. Thank you. Do you mind me asking you why you hurt yourself?
Stop the itching.
She's complained before about insects infesting her bloodstream.
Seeing some pretty impressive rash here. It's almost discord in nature. Let's get 60 milligrams of prednisone. Try to clear that up, please.
Emily, you mind if I sit for a bit? Help you keep watch?
Okay.
99 bottles of beer. Sorry, stuck in my head. Here, take one down, you pass it around.
98 bottles of beer on the wall.
Oh, I know you could sing.
Yeah, don't tell anybody. Sharon?
Hey, Dean. Daniel, I wanted to go over the admission sheets for the psych floor, and I also thought I'd be nice and grab you a coffee, but it looks like you beat me to the punch.
Don't you worry about it for a second. This one's finished. That's so nice of you.
Oh, long night?
You know, I started to volunteer at a suicide hotline a few weeks ago, and my shift ended at 2 a.m., but I'm fine. Hey, I'm actually having dinner with Howie tonight.
Yeah?
Burning the candle at both ends. Those hotlines can be emotionally draining, yeah?
Sure, but after that little scare with Anna last year, I just get this knot in my chest every now and then, and being the guy on the other end of the line, I don't know, it kind of helps.
Dr. Archer, got an EMS call that might require several sets of hands.
Okay, let's go. Let me guess, acupuncture?
Yeah, Gail Spinner, 43. She was mid-session when she fell off the table and onto her back.
How you doing, Gail?
You ever been in pain in 500 goddamn places at the same time?
Ready, on my count.
Holy pincushion Batman.
Be extra gentle here, please. Ready, 1, 2, 3.
Oh, I was on the table and I had this spasm. I think the technician put a needle in the wrong spot or something, and I just seized up and tilted over onto the floor, and now I look like a damn porcupine.
Let's get pickups and hemostats.
Yeah, and also, give me 4 milligrams of morphine, please.
Okay, easy there, Tiger. I don't like taking pain meds.
It's just this might be an arduous process. You may want something to manage the discomfort.
Except it makes me constipated. Like bad. Like an old cement mixer.
It's very graphic.
You're fun.
It's your call, but we can give you something to help with the constipation.
What do you say, Chuck? Should we let him fill me with painkillers? Read that for me, sweetie.
Oh, you may rely on it.
All right, let's go. Load him in.
All right, yeah, let's give her the morphine and 100 of Colace, and you may want to loop Dr. Charles into this.
Hey, thank you for meeting us out here in the cold. Okay, RV's a little big to get in by the ED.
I live to serve.
Easy, Dad.
How we doing here, family?
Well, we were on a weekend trip to Cuyahoga Valley.
Which we should still be on.
Dad took a little fall, twisted his ankle.
Damn black ice.
Figured with the MS and all, we should be safe. Come back early, get an x-ray.
Not broken. I know what it feels like to break a bone.
James, stop acting like a cowboy. Sit.
To take a load off Mr. Frost.
Yeah.
Hell no.
Oh, James.
Dad, all right.
You know, I didn't really peg you as the outdoorsy type.
I got layers.
Huh.
Out of curiosity, what type did you peg me as, though?
I don't know, kind of like a guy who might be familiar with moisturizer.
True.
This is great. I hardly feel anything now.
I'll be back in a second. Hey, what's going on, Jeremy?
Oh, we're not here for me this time.
I'm supposed to be induced next week, but my water broke.
Oh, it's exciting. Dr. Asher?
Yep. Hey, you two, everything okay?
Yeah, Esme was saying that her water broke this morning.
I've been trying to reach my OB, but her office hasn't connected, and I wasn't sure where to go, so.
And we're used to coming here.
Totally get it, and I am happy to get you sorted. Let's get you up to L&D and into a bed. And your OB is Dr. Rebecca Brown, right? Yeah. I've worked with her a little. She's great.
One of my patients is looking a little rough, so I'm gonna have him checked out. You got this.
Yeah, sure thing. Hope it goes okay upstairs.
Outlook not so good.
Chicago Lifeline. This is Dan. What's going on tonight? Hello? Are you there? Did I lose you?
I'm here.
Oh, there you are. Tell me what's happening.
I want to die.
Thank you for your honesty. I also appreciate you saying that out loud because that's not easy to do.
It's all I can think about. My brain just keeps, I don't know, running in circles, and it always comes back to that. I can't eat, I can't sleep.
Not sleeping absolutely sucks. Do you mind if I ask your name? Or at least, you know, what you'd like me to call you?
It's Gio.
Gio. Okay, Gio, thank you.
It was an accident. It was my fault.
What was your fault?
I killed my girlfriend.
Okay. Think it might help to tell me what happened?
Why? Why? How would that help?
Well, you know, you said that it was your fault and that it was an accident, which is interesting because, you know, I mean, accidents are, well, I mean, they're accidents, right? I mean, they're not on purpose.
We went to a holiday party. By the end of the night, she was pretty hammered, but I only had a few beers, so I drove us home. She started feeling sick, so I was driving pretty fast. I didn't want her to puke in the car, you know what I mean?
Oh, I sure do. That's the worst.
Yeah. We were coming up on a big intersection when the light turned yellow, so I gunned it. Then out of nowhere, a woman stepped into the crosswalk early. I slammed on my brakes. I tried to steer around her, but the car spun out of control and slammed into a traffic pole on the passenger side. When I looked over at her, her eyes were open, but she was gone.
Man, I'm just so sorry, Gio. That sounds awful. I mean, awful.
Oh, it's like a tape loop in my brain. Oh, it hurts so much, and it never ever stops. I need to make it stop.
Okay. You know, there is a big difference, though, right, between being involved in an accident and intentionally causing someone's death, right? And I want you to trust me on this. Like, grief and guilt are really, really good at blurring the difference.
It was my job to get her home safe.
You want to know what the cruelest thing is about accidents that happen really quickly? It's that after the fact, we slow them way down, and then we start to play them over and over again in our head, which creates the illusion that we might have done something differently, right? That we could have somehow created a different outcome, when the truth is that that was just never, ever going to happen.
Look, you're clearly a nice guy, but none of this stuff is gonna bring her back.
No, it's not. And I can't even imagine how difficult it must be to accept that. Gio, can I ask you, do you have anything with you that you might use to hurt yourself tonight?
I could.
Got it. And where is the gun right now?
In my hand.
Okay. Look, I'm going to ask you to do something for me, all right? And that is, I just want you to put it somewhere, just for now, put it somewhere where you can't see it. You still there, buddy? Sometimes it can actually help to talk about people that we've lost, right? You think that might help to talk about her a bit? I mean, there is no wrong answer to this question. I'm just asking.
Her name was Darby.
What is? What? Gio, look, it's so important that you feel this stuff.
Look,
It is.
You can't possibly understand. It's torture.
Buddy, listen.
I can't do it anymore.
No.
No. No. I'm sorry.
Gio, listen. Loss like this brings a kind of pain that can't be solved or explained away. You just gotta talk about it. You just gotta feel it, right? But just because you're feeling it doesn't mean you have to act on it. Feeling guilty doesn't mean you don't deserve. Gio.
Stay with me. Just focus on me. That's it. We're gonna help you. Your daughter's on her way. How long was he down?
An hour, maybe two. Trauma
250 cc's of 3% saline to reduce intracranial pressure. 1 gram Keppra, procedure prophylaxis.
I'm on it. Dr. Lennox, he's losing consciousness.
Stay with me. I need you to stay with me. Let's start a trauma workup.
Yeah.
What do we got?
42-year-old male fell head first off his roof, taking down Christmas lights, smacked his head on the concrete. I'm thinking he's got to bleed.
Yeah, so am I. His pupils are blown.
No gag reflex, no cough.
No brainstem reflexes. He's brain dead.
Yeah, let's do a CT to confirm and keep him on the vent until his daughter gets here.
I mean, it's already April. Should have kept the lights up till next year.
Sharon, you seen Daniel? He's not answering his phone. I got a 20-year-old who just confessed to shooting JFK. On the bright side, knows his American history at least.
I think Daniel's probably somewhere cooling off. I'd give him his space.
Really? What happened?
We had a pretty bad argument.
Oh. What about?
He accused me of not having his back.
Well, that doesn't sound like Daniel.
Exactly. That's why I'm worried.
What's going on? Like, what are we doing here?
Oh, come on. If you're asking the question, you already know the answer.
Mom, I'm not dead like you.
Maybe not yet.
And I'm not dying either. For God's sake. I'm having a dream. And I just don't know why we're here.
Listen, I know you think this is all about that poor kid you killed. What was his name? Gio, who finally got up the courage to reach out for help and then had the terrible luck to have you answer the phone.
When did you become so cruel? Did somebody do something to you so terrible that made you feel so small that for the rest of your life, the only way you could feel good about yourself is if you were making somebody else feel miserable, especially your kids?
Oh, Danny, you poor thing. There you are, huffing and puffing, and you still don't get it, do you?
Get what?
Why we're here. The answer, my darling, is this is where it all started, isn't it? This is where it happened. Right over there.
Daniel, can you hear me?
Sharon?
Daniel, are you okay? Dean, I just found Daniel unconscious on the floor in his office. I think he may be having a stroke. Can you please come up here? Daniel, can you hear me? It's Sharon, Daniel.
Move! Get out of the way! Get out of the way! Stop!
Stop! You gotta go!
Haley, you got a head wound. I'm not going anywhere.
Jake, he's getting away. You gotta
Stop!
get him away.
Stop!
I'm fine. I just need a second.
It's good to see you.
What's the matter? Chest feels tight. It's like I can't get a full breath, you know?
Pull over. I'll take the wheel.
Cap. What?
And you're sure they weren't the gloves he was wearing in the morgue?
No, these were flesh-colored, more like a second skin. They had a logo on them, 2 diamonds with a word underneath. I think it started with an A and an E.
Wait, Apex?
I don't know, could be. What's Apex?
Apex Biomedical Technologies. Do these look like the gloves?
Yes, exactly.
What are they?
They're compression gloves. They're prescribed and custom fitted to manage symptoms from connective tissue disorders, burns.
Prescribed means traceable.
Yeah, I'll have my team contact Apex, pull every order filled in Chicago.
I just don't get it. Why was he digging around inside of, what's his name?
Omar Bengoa.
Bengoa specialized in body packing. You familiar?
Yeah, we've had some cases in the ED. Mules ingesting pellets of drugs to avoid detection at the border.
He was paid triple his normal amount to have 2 capsules implanted.
Implanted, surgically.
It lowers the risk of rupture.
Maybe that's it. Burst inside of him, killing everyone on board.
A cabin pressure change could have compromised the seal.
So the plane wasn't an attack, it was an accident.
And he came here looking for the capsules to see if one of them survived.
What's her status? 72 now. She's Brady, 48 and falling. Baby's got a strong heartbeat. Hey, you've got a fighter in there.
What's her blood pressure?
I can't get a read. Weak radial.
Ambo 61 to Maine. Our patient is crashing. We have to get her inside the hospital. Try moving her on her left side to relieve aortic cable compression.
Copy 61, the message is being relayed. Continue to stand by.
She's down. No pulse.
Push epi and mark time of arrest.
11:41.
We've only got 4 minutes. If we don't get Ross...
Baby needs to come out. It's our only shot at saving them both.
Ambo 61 to Maine. Our patient is in cardiac arrest. If you won't let us inside, we need an OB to the Ambo now.
Ma'am, return to your vehicle.
We've got a woman in the back who's gonna die without my help.
Ma'am, hold. Let me radio our incident command for clearance. Ma'am!
Every cadaver was x-rayed upon intake. I just had Omar Bengoa's scans uploaded. These white specks are fragments of the capsules that's suspected to have ruptured.
And here's the second capsule intact.
Were you able to see if you...
Yes, one of our pathologists just did a full sweep of Bengoa's abdominal cavity. The second capsule is gone.
He got out with it.
If this guy's willing to risk getting apprehended, then...
Knowing he's facing almost 200 counts of homicide if he's caught, and whatever he's planning, it's already in motion.
He needed his chemical weapon now.
My gut's been telling me from the beginning this is local. He had it transported where he's gonna use it.
Man, am I glad to see you, Dr. Asher.
How long's she been down?
3 minutes and 49 seconds.
Hey, don't stop compressions. Once baby's out, mom's circulation should hopefully improve.
4 minutes.
Do you have Pitocin on board?
No, but we got GXA. I'll prep it.
Good. Uterus exposed. Uterine incision. Okay, here baby comes. Hey, baby girl. It's okay. You are okay. Yes, you are.
Okay. Try to remove as much amniotic fluid as possible and check for signs of exposure. Here you go.
All right. Airways clear. Pupils equal and reactive. Good strong cry, good tone. No immediate signs of exposure.
She's hemorrhaging. Give her a gram of TXA.
TXA's on board.
Pupils fixed and dilated.
Come on. Come on. Come on. She's gone, Lizzie.
Oh, Ma, this is beautiful.
Well, I have found myself with time on my hands for the first time in years.
Wait, is this my Janet Jackson t-shirt?
It is. There's something from every member of the family on there, so you can take us with you when you go.
Ma, now we talked about this. Indianapolis is just 3 hours away by car. Oh, you expecting someone?
No.
Surprise! Great to see you, man.
David, we thought you weren't coming.
I thought I couldn't, and then I had a Chicago client who needed a visit,
Oh.
and so 2 birds.
Oh, thanks for coming.
Even if you had to come up with a work excuse.
Hey, I'm here.
Yes, you're here. Give me your coat.
Ooh, good morning.
How are you so perky after last night?
I don't seem to remember you complaining.
I think around 2, I might have started.
Listen, there's this dive bar I want to go to tonight. It's in Canaryville. It's a biker bar.
Oh, I was thinking more like a bowl of popcorn and some Office reruns.
I feel like life is meant to be lived.
Yeah, it's the living that's killing me. It's getting a little bit out of control.
Oh, well, I think control is a little bit overrated.
Who even are you?
Oh, you don't remember? Oh, let me show you.
Get dressed. Overnight was slammed with a gas explosion. We're short surgeons.
All right, it'll just have to wait till the biker bar.
There is something else happening. Connie is pregnant.
She's... Wow. Oh, that's wonderful. Well, it would even be more wonderful if I ever met her.
No, I know. You will soon. It's just that she carries a marker for Tay-Sachs, which isn't a worry if I'm in the clear, but the genetic test wasn't conclusive. So I need a family medical history.
Okay. I see.
I was hoping to get in touch with my biological father if you knew.
Well, you know, I have an address, but that's been years, baby.
I mean, I could get another genetic test, but the doctors, they say that...
You should have a full family history. Yeah.
Yeah.
You called me?
Yeah, Cody Metaverse, 17, collapsed at camp. Apparently had a full-on seizure.
Sorry to hear that. Cody, I'm Dr. Howard. What were you doing before the seizure happened?
We were at practice. I got tackled.
He was seen here 2 weeks ago for a concussion?
Yeah, I'm thinking post-concussive syndrome. Second one.
Yeah, I agree.
Doris has contacted your parents, but in the meantime, let's get you into a gown, okay?
I have to go.
Hey, it's gonna be okay.
No, I have to get back.
Cody?
Oh.
He's seizing again.
Let's get him on his side. Get him 2 of Ativan, 4 of Zofran, all right?
We got a major MVC, 3 critical coming in. All hands on deck. Dr. Ripley, you're up. Trauma 1.
In a minivan versus a flatbed truck full of rebar. Head on. 8-year-old male unrestrained. Right arm fracture, impalement, degloving on the right leg. Tourniquet was applied for pulsatile bleeding.
Gonna need a surgeon?
You've got one. Let's give 1 gram Ansef, and we gotta get that tourniquet off and save his leg.
Tourniquet's been on for over an hour.
Well, I don't start worrying till at least 6. Dr. Howard, you're with me. Dr. Ripley, on to the next.
Trauma 2?
13-year-old female. Her feet were up on the dash. Deformity of bilateral tib fibs. Heart rate 112, BP 109 over 62.
Okay, I'll help.
All fractures closed. Let's get some labs and then off to CT for pan scan.
Trauma 3?
Female, late 30s, helmets to the neck and abdomen.
I can see that. How's she conscious?
She keeps calling out for her kids. Gave 50 of fentanyl en route. Heart rate 115, BP 100 over 60.
I guess we're waiting for the driver of the truck.
He walked away from it.
Yeah, lucky him. All right, hang 2 units, pack cells, please. I'm sorry if this is uncomfortable. All right. Peritonitis. We need x-rays fast, and let's get her to the OR, please.
We don't have one. Lennox took the last OR upstairs.
Oh, well, then just cancel elective surgery.
Already did. It's all the gas explosion.
All right, then we'll just do it here.
Okay, I'll get set
Come
up.
on.
Colin! Sarah! Please, my children!
Dr. Abrams came by earlier. Said there's still no shrinkage to the spinal mass.
It's only a second treatment. It's off-label. It needs time to take effect.
I know this hasn't been easy for you, son. Signing up for the reboot and looking after your old man. What I'm trying to say is thank you. It means the world to me to have you back in our lives again.
I feel the same, Dad.
Hey, I saw you tried to call me last night.
Oh, yeah, sorry, that was nothing.
Yeah. I'm sorry I didn't pick up. I was with Jennifer, and I didn't notice it till the morning. What'd you want to talk about?
I've been thinking a lot about the baby shower that everyone's throwing for me tomorrow.
Okay.
I cancel it, but I'm nervous that I'll just be disappointing everyone. I mean, what do you think?
What do I think? I think the only person's disappointment you need to worry about is your own. You know, maybe mine.
I'll cancel that.
Okay.
Thank you. Oh, and hey, I'll try not to call that late moving forward.
So you think it went well?
Well, which part? You know, the EKG or the PF study? Or the fMRI somebody threw in at the last minute? Whose idea was that?
Well, that came from legal. My guess trying to placate the insurance company carrying our malpractice policy.
You know what? A lesser man might be insulted having to take a battery of tests to get his job back after 29 years of stellar service.
Yeah, well, I'm sure a lesser man would. But seriously, any lingering effects from the hemorrhage?
Nope.
I'm relieved.
Look, I don't want to freak you out, but there is a small but very real chance that I could, in fact, be immortal.
You know, Daniel, I'm really glad you decided to stay. I'm not so sure I'd like being here without you.
Right back at you, old pal.
Morning.
Morning.
Feel like we haven't had a shift together in a while.
You are right. I make the schedule.
Hey, I was thinking maybe we should grab dinner, talk about the other night.
Yeah, maybe.
Hey, guys. Some jackass just parked in the middle of our Ambo Bay.
Oh, excuse me.
It's... use your abdominals.
Kip?
Okay, good. Here. I need your help. This is my colleague, Troy.
Hey.
I just talked a customer into a luxury vehicle upgrade. Troy ran off to pull it around, and he fell down the stairs. He was acting kind of spacey, so I drove him over here.
Yeah. Did you hit your head, Troy?
I think so.
Mm-hmm. You should have called an ambulance.
Hang tight, Troy. We'll get you a gurney.
Hey, Jagoff! I got a pregnant patient whose water broke back here.
You need to move your car.
It's not my car. It's one of my rentals.
I got you, Matt.
It's a hospital.
I will move.
Hey, guys. I'm Dr. Asher. I'm an OB. The medic said that your water broke.
I'm only at 36 weeks. This can't be happening.
Okay, it's okay. Sometimes labor comes earlier than expected. Babies tend to call the shots, and you're only a week before being termed,
No,
so...
you don't understand. If I go into labor, my baby will die.
Dad, don't shoot. It's me.
You scared the hell out of me, you know.
Well, where's your mask?
I lost it chasing down one of these.
Run!
You know, when you suggested a father-son baby moon, or whatever the hell this is, I wasn't picturing this.
Yeah, well, Build-A-Bear was booked.
Ooh.
So, how you feeling about it all? Having a daughter in 2 weeks.
You know, I feel ready, excited.
Son of a bitch! Ow! How's your, girlfriend handling it?
We're not exactly. Jennifer and I broke up a few days ago.
Oh, I'm sorry to hear that. What happened?
She's convinced I've got romantic feelings for Hannah. What is that? I knew if I told you, you'd make a thing of it.
Hey, I don't need to make a thing of it. It's already a thing. I just don't know why you can't tell her.
Tell her what?
That you're in love with her. It's not like it's gonna get any easier once you're trying to raise an infant together. Tell her now, before it gets crazy. In your face!
I'm just hoping for no surprises. I mean, I have been on the other side so often that I just want a smooth delivery and a healthy baby.
For sure. Keep it simple. It's my new mantra. That and more spaghetti, less regretti.
Oh. Did you hear the good news about Will and Natalie?
I did. Patrick James Halstead, 9 pounds, 4 ounces. I already sent a blanket.
Of course you did. Speaking of, aren't you supposed to be out of here?
Okay, today is my last day. I'm just showing Dr. Lavelle a few things before the handoff.
Not right now. Whoa, what is their deal? Lover's quarrel or Lennox's standard venom?
Okay, you know what? I would steer clear of the personal drama as a new hire. I think that could be a better mantra for you.
Yeah, but where's the fun in that?
Okay, come on. I need to show you some things on the OB cart.
Find me later. I'll give you all the tea.
Oh, I love that for us. Yes.
Hey, Daniel.
Hey.
Hey. Look, I'm glad I caught you. I want to talk with you about Dr. Rabari.
Great. Just so you know, I sent my fMRI to my neurologist buddy at UCLA, and when he gets back to us with the all clear, well, then hopefully we can just start to leave this ridiculousness behind us.
I'm not sure that's going to do it.
What's this?
There's a board meeting tonight. This was just disseminated. It's about Dr. Rabari's leadership role at Gaffney.
There's like his whole life story in here. Research papers and stuff? What is his dating profile in here too?
Well, he knows if he's going to try to oust you, he's going to need all the ammunition he can get.
Wait, you think he's like officially going to make a play for my job at this board meeting tonight?
Yes, I do. Which means we have 10 hours to make sure that doesn't happen.
Rough night?
Great night, actually.
Not sure I believe you.
Okay, Mr. Cheerful.
That's Dr. Cheerful, and Johns Hopkins is launching a new clinical trial for prion disease. You make an excellent candidate, and I can also make a call.
I'm not interested, thanks.
You should be.
Well, I was gonna tell her to even go. What? No, she's your best friend from med school. Look, I will bring a change of clothes to work tomorrow. We're going.
Yeah?
Yeah.
Okay, great.
There he is, my absentee roommate.
Hey, yeah. Just been staying at Naomi's place. It's a lot easier.
Did you not have sex in my guest room?
I was gonna say the commute's better, but also that. Yeah, definitely also that.
You really seem to be jumping in head first.
I don't mean to. I don't know. It's like I don't like not being around her.
Eloquently stated.
No, she's cool. You know, she's open, and easy to talk to. There's no games with her. You know what I mean?
Actually, I have no idea what you mean.
So that, honeymoon stage fizzled out with Lennox, huh?
Why don't we grab a beer after work?
Dr. Frost, incoming.
Hang in there.
Maxwell Hodges, prisoner at Oakville Correctional, got into an altercation with a guard who's coming in behind us. Complaining of severe pain, lower left chest.
Trauma 2?
Decreased breath sounds?
No, equal bilateral, some contusions on his face, but no LOC per witnesses. Heart rate 100, BP 124/89.
Get an x-ray in here?
Got it.
Wait, how old is he?
Just turned 18.
Don't let the baby face fool you. Kid's in for a double homicide.
On my count.
Oh, hang on, he's still cuffed.
Okay, can we get these off, please? 1, 2, 3. Okay, let's get 4 morphine, 4 Zofran IV.
Right, engage. Left AC. BP's dropping a bit.
Severe tenderness in the lower left costal margin. Lots of bruising. Where's that x-ray? Got multiple potential rib fractures. What the hell happened here?
Jason Walker, 45, the prison guard who got into it with that kid who was just brought in. Pain in his right hand.
Tenderness and swelling over the 5th metacarpal, possible boxer's fracture.
And a heart attack. You might want to tell him I'm having a heart
Mr. Walker,
attack.
you having chest pains?
Yeah, it's tightness and it's tough to breathe.
All right, EKG looks normal.
Slide over here for us.
Okay, Mr. Walker, it doesn't appear you're having a heart attack, but we will check your troponin levels to make sure.
Take some deep breaths, okay?
Casey?
What's up, boss? Yikes, the brick is blown up. Sub in for me.
Okay. One of Ativan IV.
Yeah, you got it.
Hey, I didn't mean to hurt the kid. He started yelling about something, and I was telling him to get back in the lunch line, and he pulled a shiv, and things escalated.
Someone get me Dr. Lennox.
What is it?
Apparently, the dust-up between these two sparked a riot at the prison. There's at least 40 injured, and most of them are headed our way.
Paige, Dr. Archer, tell him to get down here.
Okay.
All right, everyone. We need to clear beds. Pending admits, go upstairs now. Hold all ESIs level 3 and higher in the waiting room. Thank you. And call hospital security. Tell them to send everyone they've got.
You got it.
We understand that the situation is still ongoing.
Okay, that's good. Long push. Steady. Steady.
You're doing
good.
so great. Dr. Asher?
Okay, Olivia, I need you to stop pushing.
What?
Why are we stopping?
The umbilical cord is prolapsed. It's below the baby's head, which means that the cord is compressed and is cutting off oxygen.
Oh my God.
Wait, he's not getting oxygen?
Okay, if I elevate the baby's head off of the cord, we can maintain oxygen flow, but he needs to come out now. I have to do a C-section.
Here?
You'll be fine. It's not my first rodeo, okay?
So your first rodeo while in labor? For yourself?
Hey, Jacob, you're gonna take my place.
Wait, what?
Your hand is gonna go exactly where mine is. You'll keep upward pressure on the baby's head and you will not let it drop.
Female anatomy is not his comfort zone.
It's really not.
The baby needs to come out now and I need my hands free to operate. I am also about to have another contraction and I can't risk my hand slipping.
Okay, I can do this.
Okay.
Dr. Asher, are you okay?
I'm fine. Early labor, it's a long time to go. I've got this. I promise you.
This is fun. You have nothing to say in response to my confession of love?
What do you want from me?
Oh, no. Oh, God, nothing. I'm so sorry to bother you.
Okay. Then I'll tell you. You want to do whatever you want to do, whenever you want to do it, without any thought or concern for another person. You want to get angry when it suits you, then make light of anything when it suits you. You're not even honest with yourself, much less another person.
I love you too would have sufficed.
You're infuriating.
And what about it?
You just said you can't pretend you're not sick anymore, but you will. And I won't. I won't pretend with you, not anymore.
I don't respond well to other people predicting my behavior.
You don't respond well to anything you can't control.
CPD, identify yourselves.
Dr. Mitch Ripley and Dr. Caitlin Dennis.
IDs?
Surgeon's office here.
You're free to resume duties, but stay on this floor until the code silver's been lifted.
Yeah.
Dr. Rabari,
Trust me, the way he responded removed any doubt that I had.
can you prove it?
There's a formal diagnosis floating around somewhere.
But those records are sealed. Is there any other way to prove it?
Well, ironically, an fMRI might be able to show some statistical differences in people with antisocial personality disorder. But, I mean, why do you ask?
Unless this lockdown continues into the evening, the board is going to meet tonight to decide whether you keep your job or they replace you with Dr. Rabari.
Sharon, are you suggesting that I use Theo's sociopathy against him to disqualify him from the position?
It's the only card we have to play, Daniel.
I don't think I'm comfortable doing that.
You had a stroke, and he did not hesitate to exploit that.
Right. It's because there's the tiny issue of myself having fought my entire career against precisely those kind of stigmas that plague precisely those kind of diagnoses. I'm not going to do it, Sharon. Like, even if it's to save my job, it would just be profoundly hypocritical of me.
This is war. If we do nothing, you lose your job. Gaffney can't afford that, and honestly, neither can I.
Hey, do you know if they cleared labor and delivery?
Not yet. They're sweeping the ICU now and working their way up.
Hannah's transporting a patient up to L&D and she's not answering my texts.
When's your due date?
2 weeks from tomorrow.
Must be hard to concentrate on anything else.
It is.
Stop.
You don't want to do this.
Oh, it's too late for that.
What do you want?
You're gonna help me finish something. And if you play your cards right, I might let you meet that new baby of yours.